Have you ever taken your blood pressure medication in the morning and assumed that was all you needed to do? Have you ever wondered whether something in your kitchen, your medicine cabinet, or even your daily routine could quietly interfere with how your medication works? And what if one simple habit was increasing your risk of dizziness, swelling, low blood pressure, or other unwanted side effects without you even realizing it? If you're taking amlodipine, also known by the brand name Norvasc, today's information could be extremely important. Millions of adults take amlodipine every day to help control high blood pressure, reduce strain on the heart, and lower the risk of serious complications such as heart attacks and strokes. For many people, it works very well. But here's what many patients don't realize. The effectiveness of amlodipine doesn't depend only on taking the pill itself. Certain foods, supplements, medications, and habits can change how amlodipine behaves inside your body. Some can make it stronger than intended, others can make it weaker, and some combinations may increase the risk of side effects that can leave you feeling dizzy, weak, swollen, or even lead to dangerous drops in blood pressure. Have you ever experienced ankle swelling while taking amlodipine? Have you ever stood up and suddenly felt lightheaded? Have you ever wondered whether another medication you take could be contributing to those symptoms? Today, we're going to discuss 5 important things you should avoid if you're taking amlodipine. Some may surprise you. One of them is sitting in many medicine cabinets right now. And the final item is something countless people do without consulting their doctor. And it can be one of the most dangerous mistakes of all. Let's begin with number 1. Number 1, grapefruit and grapefruit juice. Do you enjoy a glass of grapefruit juice with breakfast? Do you believe that because something is natural, it must be completely safe with prescription medications? Have you ever checked whether your favorite fruit interacts with your medications? Many people don't, and that's exactly why grapefruit appears on so many medication warning lists. At first glance, grapefruit seems harmless. It's packed with vitamins, it's refreshing, it's often promoted as part of a healthy diet. But when it comes to amlodipine, grapefruit can create an unexpected problem. Your body relies on specific enzymes to break down medications after you take them. One of those enzymes helps process amlodipine and remove it from your system at an appropriate rate. Grapefruit contains compounds that can interfere with this process. When that happens, more amlodipine may remain in your bloodstream than intended. And when medication levels rise higher than expected, side effects can become more noticeable. Have you ever felt unusually dizzy after taking your medication? Have you noticed episodes of weakness that seem to come out of nowhere? Could your breakfast routine be playing a role? For some people, the interaction may be mild. For others, it can be much more significant. The challenge is that nobody knows exactly how strongly grapefruit will affect them until it happens. That's why many healthcare professionals recommend avoiding grapefruit and grapefruit juice entirely while taking amlodipine. It's simply not worth the risk. A healthier choice might be oranges, apples, berries, or other fruits that don't interfere with the medication. But grapefruit isn't the only common item that can create problems. The next one is something many adults enjoy socially and rarely think twice about. Number 2, alcohol. Do you enjoy a glass of wine with dinner? Maybe a beer while watching television? Or perhaps a cocktail when spending time with friends? If so, you're certainly not alone. But have you ever noticed feeling more dizzy after drinking alcohol? Have you ever stood up quickly and felt the room spin? Have you ever wondered whether alcohol and amlodipine could be working together in ways you didn't expect? Amlodipine lowers blood pressure by helping blood vessels relax and widen. Alcohol can also influence blood pressure and blood vessel function. When combined, the effects may become stronger than intended. For some people, this can lead to excessive dizziness. Others may experience lightheadedness. Some may even feel faint. Imagine this situation. A 68-year-old man takes his usual dose of amlodipine in the morning. That evening, he has several drinks at a family gathering. Later, he stands up quickly from his chair. Suddenly, he feels weak, unsteady, and dizzy. He assumes it's simply because he's tired, but the combination of alcohol and blood pressure medication may have contributed significantly. Have you ever felt unusually tired after drinking alcohol while on medication? Have you noticed balance problems? Have family members commented that you seemed unsteady? These symptoms shouldn't be ignored. Alcohol may also increase the likelihood of falls, especially in older adults. And after age 60, a fall can have serious consequences. Broken hips, head injuries, and lengthy recoveries often begin with one unexpected moment of dizziness. This doesn't necessarily mean every person taking amlodipine must completely avoid alcohol forever. But it does mean you should discuss alcohol use with your healthcare provider and understand how it affects your individual situation. Because there is another category of products many people take without realizing it could interfere with their blood pressure control. Number 3, certain pain relievers. Take a moment and think about your medicine cabinet. Do you keep ibuprofen at home? What about naproxen? How often do you take them for arthritis, back pain, headaches, or sore muscles? Once a month? Once a week? Every day? Many people assume over-the-counter medications are harmless because they don't require a prescription, but that's not always true. Certain pain relievers known as NSAIDs, non-steroidal anti-inflammatory drugs, can create challenges for people managing high blood pressure. These medications include ibuprofen and naproxen. Have you ever taken one of these medications for joint pain? Did you realize they may affect blood pressure control? Have you ever discussed them with your doctor? NSAIDs can cause the body to retain sodium and fluid. They may also affect kidney function. Together, these effects can make blood pressure more difficult to manage. Imagine spending months working hard to lower your blood pressure. You're taking your medication faithfully, you're exercising, you're watching your diet. Then a daily pain reliever quietly works against those efforts. The result may be higher readings than expected. Have you noticed your blood pressure fluctuating recently? Have you wondered why your readings aren't improving? Could an over-the-counter medication be contributing? This is especially important for older adults who deal with chronic pain. Many people take NSAIDs regularly without realizing the impact they may have on cardiovascular health. That doesn't mean you should suddenly stop every pain reliever. It means you should discuss safe options with your healthcare provider. Sometimes alternatives may be more appropriate. And speaking of medications that can create unexpected effects, the next interaction often catches people completely off guard. Number 4, sildenafil and similar medications. Have you ever assumed that medications prescribed for different conditions couldn't possibly interact? If one medication is for blood pressure and another is for erectile dysfunction, what could they have in common? Quite a bit, actually. Sildenafil, commonly known by the brand name Viagra, works by relaxing blood vessels. This increased blood flow helps treat erectile dysfunction. But remember what amlodipine does? It also relaxes blood vessels. When both medications are taken together, the combined effect may lower blood pressure more than expected. Have you ever experienced sudden dizziness after taking a new medication? Have you ever felt faint when standing up? Could two medications be amplifying each other's effects? For some people, the combination may be well managed under medical supervision. For others, it can create significant symptoms. This is why it's so important to keep every healthcare provider informed about all medications you're taking. Not just prescriptions, not just supplements, everything. Imagine visiting one doctor for blood pressure treatment and another for a completely separate issue. If neither doctor knows the full picture, important interactions may be overlooked. Have you updated your medication list recently? Do all of your healthcare providers know everything you're taking? Could there be a medication interaction you haven't considered? Open communication is one of the most effective ways to reduce risk. But now we've reached what may be the most dangerous mistake on today's list. And unlike the previous items, this one doesn't involve food, alcohol, or another medication. It involves a decision many people make entirely on their own. Number 5, stopping amlodipine without talking to your doctor. Have you ever skipped a dose because you felt fine? Have you ever thought, My blood pressure is under control now, so maybe I don't need this medication anymore. Have you ever considered stopping amlodipine because of a side effect? If so, you're not alone. Many people stop medications when they begin feeling better. Unfortunately, that's often when problems begin. One of the biggest misconceptions about blood pressure medication is the belief that feeling well means the medication is no longer necessary. In reality, feeling well may be evidence that the medication is doing its job. Think about it this way. If a person wears glasses and suddenly sees clearly, would they stop wearing them because their vision improved? Of course not. The improvement occurred because the treatment was working. The same principle often applies to blood pressure medications. Have you checked your blood pressure recently? Was it normal? Could the medication be the reason? Another common issue involves side effects. Some people develop swelling in their ankles or feet while taking amlodipine. Others experience flushing or mild dizziness. Instead of discussing the issue with their doctor, they simply stop taking the medication. This can be dangerous. Blood pressure may rise again. The heart may face increased strain. The risk of stroke and cardiovascular complications can increase. Have you ever stopped a medication without informing your healthcare provider? Have you ever reduced your dose on your own? Do you know what effect that change had on your blood pressure? The safest approach is always to involve your healthcare provider. Often there are solutions. The dose can sometimes be adjusted. Alternative medications may be considered. Additional strategies may help manage side effects. But stopping treatment without medical guidance can create risks far greater than the symptoms you're trying to avoid. And that's why this final item may be the most important one of all. Let's quickly review. If you're taking amlodipine, remember these 5 important things to avoid. Number 1, grapefruit and grapefruit juice. Number 2, excessive alcohol consumption. Number 3, certain pain relievers such as ibuprofen and naproxen without medical guidance. Number 4, sildenafil and similar medications without discussing the combination with your healthcare provider. And number 5, stopping amlodipine on your own. Now ask yourself a few important questions. Do any of these apply to your daily routine? Have you been consuming grapefruit without realizing the interaction? Have you been taking over-the-counter pain relievers regularly? Have you ever skipped doses because you felt well? Could one simple change help you manage your blood pressure more safely? Remember, medications work best when they're part of an informed plan. The more you understand about your treatment, the better equipped you are to protect your health. And when it comes to high blood pressure, small decisions made consistently over time can have a major impact on your future. Your heart deserves that attention. Your blood vessels deserve that care. And most importantly, you deserve the opportunity to stay as healthy and active as possible for years to come. If you found this information helpful, let us know in the comments. How long have you been taking amlodipine, and did any of these interactions surprise you? Because your experience may help someone else learn something important today.